This week's Ask Dr. Durie is from a patient anxious about the use of steroids such as dexamethasone or prednisone as part of the myeloma therapy. Now, this is a question that has come up for many years about myeloma therapy, but continues to be a very, very important question. The first point to be made is that myeloma therapy is always improved when steroids are added. So if you take a medicine plus dexamethasone frequently, the response is somewhat better. Common combinations that we use are things like Revlimid plus dexamethasone, or Velcade, Revlimid, and Dex. And so many combinations of the most active therapy used for myeloma treatment include that dexamethasone. However, we know that dexamethasone has a lot of side effects. And in some cases, for older patients or frail patients, the side effects could be so threatening that we decide that it's not worth adding in the risks of steroid therapy to get some added benefit potentially. These side effects include things like increased risk of infection, some thinning of the bones, some development of cataracts in the eyes, an increased risk of developing sugar diabetes. For all patients who are taking, for example, dexamethasone as part of their therapy, it is really, really important to assess what is the ongoing need or benefit from that dexamethasone, and what are the potential ongoing risks. And what this means is that the dexamethasone is frequently very, very helpful initially for the first number of months to get that best response. But in the coming months, after 6 months or between 6 months and 12 months, it may be that there are potential side effects that outweigh the risks of additional value with the dexamethasone. In the long term, that thinning of the bones, the risk of possible infection, and the development of cataracts, for example, these are things which can be obviously quite serious. And so whenever there is a chance, and if it's feasible, steroid doses should be reduced, and if feasible, even stopped if an excellent response has been achieved. And so the bottom line in this case is that you can see clearly that the use of steroids is something to discuss very carefully with your doctor. Do you need them? Are there side effects in your case that could be a particular concern? Can you go ahead and taper them down and stop them as you move forward into a maintenance type phase where, for example, Revlimid could be used without added dexamethasone? And so steroids, we love them, we hate them. Use them with great caution and talk to your doctor whenever you're taking steroids. And if there is ongoing use into a maintenance type situation, please raise the question with your doctor.